Yes, it's 6 minutes gone past 11 already. Good morning, Imolites. Good morning, everyone. It's a wet Thursday morning. And I know how you feel. Some people are already tempted to stay back at their homes due to the rain this morning. But yeah, you have to just go out and hustle, make some money because nobody will feed you, okay? It's on that note I say good morning to you and welcome to today's edition of Health Revolution. Health Revolution remains your daily tonic for healthy living. And my name, as always, is Mary Omeniwo. They call me the Slim Diva, your most adorable. Thank you, Barry Cosmos. I call him the B, Mr. B. Thank you so much for handing over the microphone to me this lovely Thursday morning. But before I go ahead to introduce the guest I have got here in the studio, I have some information for you. Important information I would want you to take note of. Ojezu Robodo will be on Sunday, June 28th at Obibiurata. Yes, you want to see me, you want to see Clara, you want to see Uche, you want to see Barry, you want to see Urena. DJ J-Boy, Marv King, and a host of others from Echo FM will be there live at Obibiurata on Sunday. And that's one cultural program I know you wouldn't want to miss for anything. So try as much as you can. I think the venue is Umualum. Sorry, I'm just trying to pronounce. J-Boy, am I right? Umualum. Okay. Umualum School Field, OBB Urata on Sunday, June 28th at exactly 12 noon. Try as much as you can to make it down to the venue. And then guess what? Next week, Wednesday, we'll bring you something that we usually do every year, annually. Last year, it was Unusual Monday, I remember very well. But this time around, it's going to be the Unusual Wednesday on the first day of July. Wow. I would want you to anticipate and watch out for what's going to go down that day. I don't want to let the cat out of the bag, okay? But trust me, it's going to be very, very interesting. Wednesday next week. Keep it a date with us. Okay. All right, let's go ahead to introduce our guest for today. It's no other person than Dr. Chinedum Ehirim, consultant hematologist, and he's also working with LabRad Laboratory and Radiological Services here in Imo State. Good morning to you, Dr. Ehirim. How are you doing this morning?
I'm fine. Thank you very much.
It's good to have you join us.
Yeah, pleasure is mine.
You're welcome. Yeah. Okay, and also here in the studio, although they will be observing for like maybe 40 minutes, and then toward the end of the program, 10 minutes before we round off, you will get to hear their voices. Nurse Ihoma Emmanuel Chukwuemeka. Good morning to you, Chukwuemeka. You're welcome.
Good morning, thank you.
What a delight to see a male nurse. That's not what I see every time. In fact, my week is going to be blessed.
Of course.
But how does it feel like, as a male nurse in Nigeria?
Great. Yeah, I feel good.
So when people come and you see them and they say, "Wow, you're a male, you're a nurse." No, do they tell you, "Oh, you can't attend to me because you're a male," especially for the females?
Well,
do you get that kind of reaction?
Sometimes.
Does it make you feel bad?
Yeah, but the goal is get them well.
Get them well. Yeah. I like that. Thank you so much. Also in the studio is Chiemezie Chineye. Good morning to you, Chiemezie Chineye.
Good morning.
You're welcome.
Chimezie. Chimezie Chineye.
Oh, Chimezie Chineye. Yeah. All right. Sorry about that. It's good to have you join us as well this morning.
It's a pleasure.
Okay, so let's go straight up into the conversation. For people who do not know, we are live on Facebook at Echo FM 100.7. Go right now and join us live. And then when it's time, you can drop your comments. I'll be here to read them out. And you can also send us a WhatsApp message. I'll read out the numbers much later. So quickly, on Monday, I did a little sensitization on sickle cell and its burden on families and survivors. And then while I had that conversation with people that day on radio, I discovered that in 2026, as we speak at this time, a lot of people still do not have basic knowledge on sickle cell disease. And I begin to wonder, then what did we learn in school? Biology and all of that. I don't understand. You see a full-fledged educated person telling you that sickle cell disease does not exist. They will tell you it's spiritual. A lot of things. However, I'm grateful because we have Dr. Chinedum this morning who would help us dispel some of those myths and explain in clear terms what sickle cell is again. And then I know that you have a lot of questions you would want to ask. Please, the moment I open up the phone lines, try as much as you can to call in and ask all of those questions. So, Dr. Ehirim, I will go over to you. I want you to enlighten us, refresh our memories. Again, let us start with the basics because it's alarming, it's appalling that a lot of people still do not believe that sickle cell disease is in existence. Over to you, Dr. Chinedum.
Thank you very much. I want to... before I delve into the question, first of all, I want to thank the management of Echo FM.
You're welcome.
For being here as a medium of enlightenment and information.
Thank you.
I also want to appreciate the management of Labrad for making out this opportunity to collaborate with Echo FM to ensure that our people are enlightened. I want to appreciate all of you. Thank you very much.
You're welcome.
Now, to the question, sickle cell disease, what is it all about? It's a genetic disease. That means it's inherited. Where does it affect? Many of us know what is called red blood cell because basically our blood is red in color. Now, the red blood cell carries what you call hemoglobin.
Okay.
It's a protein. That protein actually, essentially, gives that blood its red color. Now, this hemoglobin, this protein hemoglobin, is needed to carry oxygen from the point of oxygenation in the lungs to the tissues of the body that need the oxygen. The minutest tissues in the body, all the tissues in the body, they need oxygen for their basic metabolic reactions. However, in some people, there has been genetic mutation. In other words, there are abnormal changes that have occurred at the genetic level. Now, when it happens at this genetic level, because the genes enable protein to be synthesized. Now, when there is a change or mutation at the level of the genes involved in making this protein called hemoglobin, then at the level of what we call amino acids, the basic components, the essential components of proteins, now there are changes that occur. Now, when these changes occur, this protein, hemoglobin, is no longer able to carry out its functions the way it should.
Okay.
I'll give you an example. Now, for example, when there is genetic change or mutation occurring, there are amino acids that are changed, really. In normal people, there's an amino acid called valine.
What? Valine?
Valine.
Okay.
Now, valine does not exist on the surface of proteins, really, because it's what you call a hydrophobic protein, amino acid rather. Now, but when there is a change, mutation, changes that occur, now valine now displaces, there's another amino acid called glutamic acid, now which exists as the sixth amino acid in the hemoglobin, beta hemoglobin chain. Now, when this change occurs, valine, which normally stays in the inner areas of proteins, now comes to the surface and displaces glutamic acid. When this happens, this change means that this hemoglobin molecule, this hemoglobin protein, is no longer able to behave, especially when the red cell comes to areas where there are low oxygen concentration.
Okay.
Now, when this red blood cell carrying this abnormal change comes to areas where there is low oxygen concentration in the body, like in the tissues of the body that are far away from the lungs. Now, when it comes to those areas, instead of this hemoglobin in the red blood cells remaining in the fluid state, it begins to polymerize, or let me use the word congeal. The hemoglobin molecules begin to attach to each other. Now, this attachment deforms the red blood cell because this polymerization is not what's supposed to be. It's supposed to remain in the fluid state inside the red blood cell. Now, when they begin to congeal, they deform the shape of these red blood cells. Normally, red blood cells are what we call biconcave discs. In other words, if you have a peppermint, it has two excavations on both surfaces. But when this happens, this cell now begins to have a half-moon shape, what we call crescentic shape. a half moon. So many of us have seen a half moon.
Okay.
Now, it begins to be deformed into a half moon. Now, when this occurs, this deformed red blood cell begins to occlude or obstruct the flow of blood beyond this area of blockage. Now, what this means essentially is that when this occlusion or blockage happens, the tissues that are beyond this area that are blocked will not be able to get enough oxygen.
Okay.
And so the person begins to experience abnormalities. It affects virtually every organ in the body. Every organ in the body. Now, from the brain to the kidneys to the heart, the bones, where there's denial of adequate oxygen, then the tissues begin to degenerate, and eventually, of course, there will be loss of function.
Okay.
Now, another way of looking at it is this. When a baby is inside the womb, the mother's womb is being formed, the second trimester,
Yeah.
the baby undergoes a transition from what we call the fetal hemoglobin to the adult hemoglobin. So many of us that towards this adult hemoglobin, what we call A hemoglobin, is what many of us carry, that, ordinarily do not have what we call the sickle cell trait. Now, when the child is born, he's supposed to have hemoglobin, AA, or adult hemoglobin. However, in people that have experienced this mutation that I've described now in the course of this program, they're going to have what we call the sickled hemoglobin, which is the hemoglobin that has now had these changes occur in the genes and in the amino acids that it carries. And so this individual, some individuals are, they are lucky. They have what you call the trait. They have A and they have S. They could also have other abnormal hemoglobin variants, like S, like D, like E, accompanying this A. In such cases, the person will not undergo sickling. He will not have these problems because the A there compensates for the deficit of this S.
Okay.
However, in some individuals who carry this gene, who got it from the mother and the father, this mutation, they got it from the mother and the father together, then they will have what you call the SS. This SS is what you call the sickle cell anemia. Thank you very much.
Okay. Just to take you back a little, right? I've heard people say, they say, I am SS. However, it's the lower type of SS. Is there anything like that?
Absolutely not. There's nothing like that.
Okay.
But what happens is that you could have what you call the double heterozygote. In other words, you could have S in addition to a thalassemic gene. In other words, this person has S, but his synthesis of the A is reduced. In other words, he doesn't make adequate A, but the A is there nonetheless. So that means that his disease severity will not be the same as somebody who is carrying this as a homozygous state. In other words, he's carrying S and S.
Okay.
Now, if this person is carrying AX and A, but A is reduced, or if he's carrying S and beta thalassemia, for example. In other words, he's making A, but he's not making it adequately. So in this case now, the A that is there, no matter how small it is, will modify or will ameliorate the severity, the severity of the phenotype of the disease.
Okay. So it is safe to say, finally, scientifically, medically, that sickle cell is caused basically based on the genetics of a person.
Exactly.
Right.
Yeah.
Not from witchcraft.
No, not from witchcraft.
I want you to dispel those rumors.
No. It's not from witchcraft. So you see, in the times of our forefathers, they used to call them, many of them, the children that were born in these homes, that where both parents carry this abnormal hemoglobin, gene. They say they were wanje, abiku, all those kind of things, because those children died at very young ages. Now, but scientific knowledge has come, and there's light. Light has come. So it's good to come out from that darkness and enter into the light and be enlightened, so that our people who are dwelling in the villages, who have no access to basic laboratory diagnosis, they will come out and their lives will improve by reason of exposure to information.
Okay. Then how do we also put this? I think I stumbled on something. I can't remember if it was last year, a mini documentary where a woman was being interviewed, and she said at that time she was AA, her husband was AA, only for them to have a baby who was born with SS. And then she came out to say she took the child to the ministry. They went, for prayers, and they were told that the blood was exchanged while the baby was in her womb. How do we explain this?
Well, you see,
these are controversies, controversial stories.
They're not really controversial.
Okay.
You see, there's nothing that ignorance will give birth to that is controversial. Ignorance is ignorance, and once you bring scientific knowledge to it, it becomes dispelled.
Okay.
So the question is the person dwelling in that ignorance, or is he coming out to get scientific knowledge? So now, how do we look at it? If you are AA genotypically, that's what you are. If you are AA and then you go for genetic testing and you are AA,
Okay.
absolutely, there's no likelihood that scientifically this is going to change. I am a Christian and I believe in God, that with God all things are possible.
Very true.
But then, in this regard now, we are talking from what we can test in the laboratory.
Okay.
If you come to me and I test you and you are AA, and you are, I'm sure that you are AA, definitely you are AA. However, the problem arises from a system, which is where LabRad is coming in now, a system where people have all kinds of derelict laboratories.
Okay,
that
we'll come to that.
Okay.
We'll come to testing, because I've also heard cases where people will say, oh, I went to so and so lab, I did a test, they told me I was AA, I went to another lab, I did a test, they told me I was AS and all that. We'll come to that aspect. Okay. Let's talk about the complications now.
All right.
What could happen to a person who has got the sickle cell disease?
All right, so now I think we should go from the features to the complications.
Go ahead.
All right, now, when a child is born, child who has this, homozygous state, has SS, basically, or SE, or SD, what happens is at the early stages, depending on the presence of other factors, actually, there are ameliorating factors that can happen. Now, what you call hemoglobin F. If the child has a high percentage of hemoglobin F, the features of this disease might not manifest immediately. However, in due time, it will come. Yeah.
Hemoglobin F.
Hemoglobin F, yes.
Oh.
It's a modifying factor.
Okay.
Now, when this child is born and he begins the first few months, perhaps even years, he might not show features of the disease.
Wonderful.
But along the line, the parents begin to notice what we call the dactylitis, the so-called hand and foot syndrome. They begin to notice that the digits of the fingers and the toes, they begin to swell up. Now, as this happens, the child, they begin to also notice that he begins, when he walks with a limp. He's having pain on his joints. Now, not only that, they begin to notice that he has yellowness of the eyes.
Okay.
Because this red blood cell that is not, that is rigid, it breaks easily, what we call hemolysis. Now, as it breaks and is hemolyzed, it releases bilirubin. Now, a lot of these bilirubin, the liver, of course, will do what we call conjugation, try and bring it together so it can be excreted. However, a lot of the time, the indirect forms will begin to filter through and begin to be deposited in tissues of the body, especially the eyes. You're going to see the yellowness of the eyes. The parents begin to notice this. What is the problem? The child has yellowness of the eyes. Now, he walks with a limp. When he does a little exercise, he gets easily tired. Now, he's not growing like other children in the neighborhood. They watch and they see other children growing. This child does not appear to thrive as other children in the neighborhood. Now, he keeps, he from one sickness to the other. He gets easily sick. The parents will take all this in their stride. I mean, the love is still there at that moment. Now, but when he gets to puberty, to manifest the signs of puberty, like facial hair, like breast board formation, like muscle development, all those things, dark voice of the deep voice of the male.
Yes.
His own is delayed.
Okay.
He doesn't get to manifest these things at the appropriate time. Not only that, many of them do bedwetting. They bedwet into adulthood.
Oh no.
Because they have what we call hypostenuria. They're unable to concentrate urine. So they keep bedwetting into adulthood. And not only that, many of the males, they have what we call priapism. In other words...
What did you call that? Priapism.
Priapism,
okay,
yes. In other words, where there is penile erection independent of sexual stimulation. So they experience priapism. This might be the only thing that some of them will manifest. And the parents will wonder, what is the meaning of this? This guy does not have any knowledge about sexual, activity. Yet he has this unrelenting penile erection.
Okay.
So at this stage, of course, questions will begin to arise. But if the parents do not take it up, then complications will begin to set in ultimately.
Wow, you mentioned the hemoglobin F.
Yes.
So, like, from what age brackets can this manifest?
Now, hemoglobin F, actually, they carry it from the womb. Like I said, is the predominant hemoglobin variant, hemoglobin type, when the child is in the second trimester, moving from the second trimester of pregnancy to second trimester of pregnancy. It's still, however, in many people, like in many people that are born, some of us here will still have some remnants of it.
Okay.
However, in some people, certainly people that have sickle cell anemia, hemoglobin F persists even to adulthood. The presence there is a modifying factor. That the severity of the manifestation of the disease is not the same, especially in people who have high levels of it and people who have low levels of it.
Okay.
There are people out there who have like 30% of their hemoglobin is F. And if they are sickle cell anemia, they will never have crisis. They will never show it. You will never know. We had a case of a young lady who was about to get married, and then she went and tested, and they told her she was hemoglobin SS.
Okay.
So she did not believe it because she had never had crisis. She had never had blood transfusion. She had never had to go to hospital, for any reason whatsoever.
Okay.
So when they came to our offices, and then we tested, I said, no, what you have actually, you have hemoglobin SS, but with hemoglobin F of close to 30%.
Wonderful.
There's a test we call high performance liquid chromatography, which is very sensitive. So the test was carried out, and it was found out that this lady actually has hemoglobin F of close to 30%. So she will never have crisis.
Wonderful.
So long as this F is there, this person will not have crisis. In fact, she will have her children, live a relatively normal life, So, but the problem begins to come because you can never really predict when it will begin to go down.
Yes.
For some people, the level of hemoglobin F reduces. Immediately they are born. But for some people, it passes, really.
Okay. All right. What a good way to, anchor right now and open up the phone lines for you to call in and ask questions this morning. Those questions you asked me on Monday. Now is the time. If you're listening right now, you're listening to Health Revolution right here on Echo FM 100.7 Owerri. And the phone numbers remain 0911 20022. 0911 20022, or you call 0707 454 1014, 0707 454 1014. Good morning to you.
Yeah, good morning. My name is Chizoba.
Chizoba, where are you calling from?
Yeah, I'm calling from Ikelebu this morning.
You're welcome. Go ahead, please.
I heard the doctor mention peniatism. Yeah, for a teenager, is it not time yet for him to develop testosterone? Is that not enough to give penile erection? Is there any clarity, please? Thank you.
Thank you so much, Chizoba. Hold your thoughts, Dr. Hirim. Let's squeeze in this call, please. Hello?
Hello.
Your name and location, please. Good morning to you.
Yeah, good morning, this Lindiva.
You're welcome, Ama.
Good morning, Doc.
Go ahead.
Yeah, my question is this. Except genetically, can it be acquired by any other means, like blood transfusion or any other thing taken into the system that can, deform the hemoglobin? Thank you, Emma, from
Thank you so much. And let's take the third one before we answer. Hello. Hello.
Okay.
Good morning to you.
Okay.
Catch you soon. You're welcome. Go ahead, please.
Yeah. Good morning, Slim Diva.
You're welcome, Kachi-sen. Quickly, please.
Yeah. Good morning, the doc in the studio.
Thank you.
My name is Kachi-sen Ekuha.
Okay.
I am calling from my community of, the West Local Government.
It's good to have you join us.
Yeah,
Go
thank
ahead.
you. First of all, I want to thank you for, complimenting, because you did this on Monday.
Yes, I did.
Yes, and we made a request, and you went all out to get someone who explained to us.
Okay.
In fact, I want to commend your strides and efforts in Echo FM. God bless
Thank you. Bless you too. Go ahead.
So I just want to ask a question, Doc. We heard that there is a particular age carrier of excess we attain, and it will seemingly be as that person have outgrown the age to die or give up.
Okay.
Yes, and according to what we had when we were in school learning biology, we had it was 21 years, that when that person grows past 21 years, that person will live to the end of his life. But then when I came to knew that it wasn't so was when one of our brothers here, he was a carrier of SS. He has passed 21 years. In fact, he was already heading to 27, 28. That was around 4 or 5 years ago. So immediately we are thinking that, yes, Ogafela age, let's make it,
Okay.
So, but we were now surprised on that very day. They said he has given up. We buried him and then. So I just want to ask, is it a superstition or just a saying? Or is it proven or not that when this person gets 21, he will give up? Or, just try to explain the whole issue.
Thank you. Thank you, Kachi Sina. We'll take the questions one after the other. Dr. Ehirim Chizoba from Ikenebu asked about penile erection, which you mentioned while you were giving, some examples when you were talking about sickle cell. And he says he needs more clarity on that.
All right. Well, penile erection, like we said, there are two ways it can occur. When males who have attained puberty, in the early mornings, they can have penile erection, but these ones go on to relax. However, also, you could have exposure to sexual stimulation, in which case the person will have penile erection because he is sexually aroused. Now, but when we talk about priapism, we are talking about penile erection independent of sexual stimulation. This person suddenly, this thing stands up and it doesn't go down.
Okay.
And not only that, initially, of course, it will stand initially and then it will go down. There will be erection, then there will be relaxation. But along the time, it could be erect for several days.
Wonderful.
It could be there for several days with all associated, suffering for the patient.
Okay.
So this is what we call priapism.
Okay. So in this case, it doesn't go down after some days.
No. Initially, when it starts coming, it might go down after some minutes, some hours, but there's no sexual stimulation.
Okay.
But in due time, you could have the ones that come and they do not go down for several days.
So what, to make it clear, what age bracket are we looking at now?
It could actually arise at any age bracket.
Really?
Yeah, it could arise at any age bracket. So a child,
a boy of maybe 4, 5, 6 could be having this as well?
Well, no, actually at that age it's not frequent. It's not frequent, really. Okay. It's not frequent, really. But then again, towards the attainment of puberty, then you begin to experience it. It becomes more frequent.
More frequent.
But it could also occur at any age because its occurrence is not basically dependent on the hormones. It's because of part of the complications. We have not yet gone to the complications of this disease, but we shall hopefully have time to go into it.
Okay, thank you so much. And then Amma asked if it can be acquired through any other means apart from genetics.
No. It's a genetic disease. It's inherited.
Not through blood transfusion.
No, it's not through blood transfusion. It's not from village people. It's not projection. It's not through point of contact. No.
Okay.
It's a genetic disease.
Thank you. And then Kachisin asked about life expectancy. And you heard all the story that he actually told. So please address that.
That again is from let's borrow from the people who go to church, from the pit of ignorance.
Wonderful.
There is nothing like that. In fact, as a matter of fact, if there is no medical intervention to try and ameliorate the progress of this disease, or to delay it, really, the progression, at that age, you would expect the complications to become more forceful.
Okay.
And, part of the complication I must point out here is that if there is no medical intervention, then death early death, life expectancy for these people is actually not
dropped.
normal. It would drop, you know. So what you are seeing is a typical occurrence in the absence of adequate medical intervention. Many of them would die in the teenage years, in the early 20s. Most of them are dead.
And then for people who already have medical intervention, take their meds, holistically and all of that, what's the life expectancy
They
for
could
such?
yes. I've attended to people that are in their 50s, they're looking relatively healthy.
That's good.
Yes, in their 50s, looking healthy. I've attended to a 60-something-year-old woman. When she came, she was 63 years.
That's good. That's good.
She was brought by her grandchildren. So, and she was hemoglobin SS.
Okay.
So she was 63 years at the time I attended to her.
Wonderful.
There was a professor at the University of Nigeria. He was 75. He celebrated 75 years some years ago. So his case was that he didn't even know really that he was hemoglobin SS until much later in his life. Possibly because of the presence of a mitigating factor. He did not go on to say maybe whether it's high hemoglobin, fetal hemoglobin, or other factors, really. But what he had basically was hemoglobin SS.
Okay.
Yeah, but he lived to above 70 years.
That's good to know. All right. So this one says, "Good morning, Miss Mary. This message is on WhatsApp, and it says, please, how is it possible that my father is AA, my mother is AA, and mine is showing AS? Although you did not add your name, please send me your name, and so that I can make reference to that as well." Okay, go ahead, Doc.
If your father is AA and your mother is AA, there's no way you're going to be AS. You see, that's where we talk about. We said we're going to come to it later in the program, where you have to have gone to a laboratory that is capable of doing the testing.
Okay.
Now, if you veer into a roadside lab that doesn't have the capacity, the technical manpower, the equipment to run your hemoglobin testing, whether it's by the hemoglobin genotype method or by high-performance liquid chromatography, the results you are getting there, you have yourself to blame, really.
That's true.
Because now when you enter into marriage on the basis of such test results, you could come out in the future adding pain to the lives of those you love.
Okay. Thank you so much. More of your calls, please, this morning. 0911 20022, 0707 454 1014. We're also live on Facebook. Go drop your comments, and I'll be here to read them out as well. Hello. Good morning to you.
Yeah. Good morning.
Please summarize, okay? Summarize so that other people can call in.
Yeah.
Quickly.
My name is Kachi Sinekwa, also calling from out.
Quickly, please.
Yeah, Doc, thank you very much for answering my first question. I have another question. Why is it that when you see patients of SS, when you look at their list, it will look like a man ogoro para man on white.
Okay.
So that is how their list look. And when you look at their palm, towards their fingers, it will also be looking whitish.
Okay.
So what is the cause?
Thank you.
From out.
Thank you, Kachi Sin. I think that will fall under complications, right, Dr. Harim?
No, it's not actually complication. It's
Okay.
actually the phenotype of the disease. This is anemia, sickle cell anemia. The reason why their mucous membranes are very pale is because they're anemic, really.
So it's safe to say that majority of the sickle cell patients at some point also suffer from chronic anemia.
Yes, they are chronically anemic.
Oh,
Really.
right from, the tender days.
Exactly. It's the foundation of the disease.
Okay, what of organ damage?
Now, that's why the complications, that's about the complications now. Now, we talked about what we call the pathophysiology of the disease. In other words, this sickle hemoglobin that goes to occlude or block or obstruct blood vessels, especially the small blood vessels in the body. Now, when it does this, it can affect any organ system in the body. It can affect the brain, leading to strokes, really. It can affect the eyes, leading to what we call sickle cell retinopathy. There was one we had some few months ago. He came in almost blind. But when we began to hydrate and treat, eyesight, and then we called ophthalmologists to come and review, eyesight became gradually restored. Now, you could also have, other organs in the body affected, like the heart. You could have cardiomegaly, you could have anemic heart failure. The heart could fail. You could have sickle cell nephropathy. The kidneys are also prone to failure. Now, in addition also, you could have the lungs, you could have hypertension, lung hypertension. You could have the lungs also being affected. You could have what is called acute chest syndrome. In other words, there are because of what we call infarction, the lungs are affected. And these are all complications that could lead to death, that could result in mortality.
Yes.
Then you could also have bones, really. You see many of them limp.
Yes.
Because the big bone in the thigh, which you call the femur, where it joins the bones of the pelvis or the hips, the bones there could die because of lack of blood flow to those areas. And so when it dies, we call it what they call avulsion necrosis. The bones of the pelvis dying. So they will need hip replacement. Many of them are going to need surgical hip replacement for them to walk normally again.
Oh, my.
So now, but when it comes also to mental health, many of these are complications really which people do not look at.
Yes.
The mental health of the people involved, both the parents and the patient. The patient, a lot of the time you go to a family, you could have five children, only one of them gets to carry this disease.
Yes.
And so this one now is left feeling, why me, really? Why is it that of all these other ones, I am the one that has been picked to suffer this disease?
Okay.
And so the mental health of this individual suffers. There are suicidal tendencies in many of these individuals. And so when you come them, one of the first things you do, of course, is sit them down and counsel them. We can make the best out of this. Many of them are also in families where the neighbors are blaming the parents. Why did you go and marry? I want folks out there to understand that they have already married, they've had children, so let's stop the blame game. The blame game is not going to reverse what has already been done.
Exactly. And that's what I keep telling people. We didn't also talk, I talked about the burden on families as well. While that child or that teenager is also suffering from the sickle cell disease, the family is as well suffering as well. So the child has come, he has come. So why still go ahead to blame them? Okay, keep your calls coming in. One last call, and then we go back to the rest of the conversation this morning. Good morning to you.
Yes, good morning.
Name and location, quickly.
Ifeatu is my name.
You're welcome.
Yes, is there any scientific study correlating the relationship between high intellect ability and this SA gene carrier?
Okay, thank you. Did you hear that, Dr. Ehirin?
Yeah.
This is AI question.
No, it's not. Actually, we've had this question for years.
Oh,
really.
okay.
We have tried to look at it. Many of them actually, like you said, their IQ is very high.
Really?
But then again, there are studies that said, okay, the reason why many of them are actually good in school is because at home they basically do nothing. They read their books. So because they read their books, they're not allowed to do any stressful thing. And those of them that are wise, they make use of that time to study their books.
Okay.
They hardly do anything at home. The parents pamper them. The teachers pamper them. So basically, all they have got to do is to read their books, and they do very well.
So talking about reading books, right?
Yeah.
Can we now talk about simple daily habits that can help reduce crisis? Is there anything like that?
Now, you're talking about interventions to help reduce crisis.
Thank
of course,
you.
now, number one, of course, is that once the diagnosis is made, the patient and the parents and the caregivers have to sit down and modify the lifestyle of this person.
Okay.
Now, the first modification you need is that there should be hydration. This patient, like I pointed out earlier, they experience what we call hypostenuria. They are unable to concentrate urine. In other words, if he drinks a drum of water now, give him some few minutes, he's going to wee it out. So he loses water, both at the cellular level, because this red blood cell that is sickled easily deforms and then loses blood. So he's also dehydrated.
Okay.
This person at the level of the body system is also dehydrated. So he needs to drink plenty of water. He needs to be adequately hydrated. This is a life, saving skill that any sickle cell patient must acquire. The ability to drink smartly.
Okay.
Because like I point, it's not just about drinking, it's about drinking smartly. Drinking smartly means drinking small quantities at a time. Dividing the volume of water you have to drink in sequences, in short, time intervals, so that you are able to remain hydrated 24 hours a day.
Okay.
Now, beyond, doing this, you need to be attending health checkups regularly. Discuss with the hematologist. I know there are a few hematologists, but you can find many of them at tertiary facilities. Brad has a hematologist, and that's one speaking to you now. So you can come around, and we will talk with you. Discuss alterations you can make in your lifestyle. About the drugs you can take, about or treatment. There are
stress. What of stress?
Exactly. Now, the counseling is part of the package of counseling. You have to find smart ways of reducing stress. This person should not be a lazy moron. No. But the person has to cut down on activities that mean that his organ systems are exposed to undue oxygen demand. that are exposed to undue stress, generating toxins and metabolites that he doesn't need to be in his system. Because eventually, of course, there's going to be damage, and then there will be organ complications, and then, of course, lifespan is cut down, and then the patient goes when he's not supposed to go.
All right, thank you so much for that clarification. And just to announce to everyone that the next 10 minutes, beginning from now, is going to be sponsored by LabRad Laboratory Services. So I'll be asking them questions about their laboratory, and they'll give us all the answers that we need. So please pay attention. And I'll be introducing again Nurse Iwoma Emmanuel Chukwuemeka and Chimezie Chinenye, who's the Business Development Officer for LabRad. You're both welcome again.
Thank you.
So go ahead. Any of you can start off. Go ahead and tell us about your laboratory and your services.
Okay, thank you once again. Based on the lectures, the health talk about sickle cell, so at LabRad Diagnostics, we offer a lot of laboratory services, and we have one of the best state-of-the-art modern machines that make sure that we give out the best. We're all about providing the best to our patients or clients, and also we give accurate results to them. So first of all, we'll start off with full blood count, which he mentioned about health checkups for people with sickle cell diseases. Full blood count, you come to us for full blood count, blood film examination, ESR, reticulocyte count, blood clotting profile, blood grouping and cross-matching as well. Because I heard someone ask the question that he was or she was AA, the father AA, the mom AA, and then she's AS. So it could be an issue or a mistake from going into any kind of lab, and then they end up giving you a wrong result. But such things don't happen. We have an hematologist who makes sure and confirms that whatever result is being given to you is accurate. And also at LabRad Diagnostics, we have the only 1.5 Tesla MRI that could be able to scan and get whatever lesion that it is that you need to look at in a patient. Then we have our 160 slide CT scan, which is the CT that sees what others don't see. And also at LabRad Diagnostics, we have a department called LabRad Hematology, which deals with blood and blood bank services, blood products. So he also mentioned in the course of his lecture, he mentioned about blood transfusion. Yes, we do that. We provide blood, and we provide blood products such as fresh frozen plasma, platelet concentrates, depleted blood cells, and the rest. But one thing you should understand that everywhere people claim to have blood banks. But one unique thing about LabRad Diagnostics is that we make use of what we call the ELISA automated machine. Because we all know that everybody wants to get blood, and then we screen the blood. But people make use of what we call the screening strips, HIV strips, and the rest, which we all know that there's something called a window phase. Let's say someone has HIV now. It's going to take up to 3 months for it to show positive. So, but our ELISA machine can identify any viral infection if it's being contacted today or this minute. So that's one unique thing about LabRad Diagnostics. So whatever product we give to you is authentic and verified and perfect and would serve you well.
That is good to know. So what of speed, reliability? How do you prioritize urgent, maybe time-sensitive samples? You know, some people most of the time come from rural areas. All of these things, are they part of your services as well? Are you assuring patients and people who would want to patronize you that the moment they come, they get the accurate results, and not just the accurate results, but they get it on time as well?
Of course. We run emergencies 24/7. Anytime, 2 a.m., 3 a.m., we are there for you.
Okay. So what of equipment? Apart from the blood testing and every other thing, are there other equipment you want us to know about?
Yes, I mentioned 1.5 Tesla MRI, where we do our MRI spectroscopy, MRI angiography, prostate MRI, cardiac MRI, breast MRI, and all body MRI, brain MRI too. So we also have our 160 slice CT scan, which is the CT that sees what others can't see. So we do our CT myelogram, all CT scans and angiographic studies. So we have our ultrasound, our EEG, stress echo, and stress ECG. We have we have other laboratory equipments, just like I mentioned in the blood bank as well. So, but we are all focused at giving people the best, not just giving accurate results like you mentioned, timely interventions too.
That's
so
good.
That's it.
Okay, so tell us about your location, phone numbers for inquiries too.
Okay, I'll hand my colleague will be the one to answer.
Go
that.
ahead, any of you can.
Okay, our main office is opposite Federal Secretariat behind the Linksford Station, Port Harcourt Road. We have another branch too at Kachimo Plaza, opposite Liquid Bulk Filling Station, Obinze, at that Futo Junction.
Okay, phone numbers.
And sorry, we have another center too at Port Harcourt Road, to that kilometer 17 over the Port Harcourt Express Road. That's where our MRI center is, besides Regions Hospital. We have our phone numbers, 070 44 44 4465.
Again.
070 44 44 4465. We have another one too, 070 33 50 1252.
Again.
So 070 33 50 1252. So these are our phone numbers.
Okay, thank you. And yes, people are listening to you right now. Nurse Emmanuel, and they want to know, they would want to come to your laboratory for testing. Why should they choose a Labrad? The truth is, in the whole of Owerri, there are so many laboratories. What makes Labrad stand out from the rest?
Okay, like you mentioned, there are a lot of laboratories everywhere. So one unique thing about us is the timely interventions to samples, and then we have doctors who interpret our results for us, doctors who stay abroad, UK, United States, and they will make use of an accurate for our test reports. So we don't just do the test and then we give you the report. No, professionals give you the report. So that's one best attribute we give to people. So you don't just come to a test and then you see the lab technicians attending to you and then telling you what to do. No. And secondly, again, we have in-house doctors who consult for free.
Okay.
Yes. When you're quiet, you're not feeling well, and you're confused about what to do, come to Labrad. Yeah, the doctors will see you, the doctors will talk to you, give you time, we explain things to you, and then they send you for test. You do the test, the result comes out, you come back to the doctor tells you what to do about it, and that's it. So
another thing too is that in Labrad we have state-of-the-art equipment. Here in Nigeria, we only have 1.5 Tesla MRI, that is AI enhanced, that also do special investigations. Our MRI machine doesn't just capture images, but we also go further to do high-profile investigations. Like he mentioned earlier, our MRI machine can do breast MRI, prostate MRI, even the MRI spectroscopy, and other specialized MRI studies too. You only get such machine and that machine only in Labrad Diagnostics in the whole Nigeria.
Wonderful.
Recently too, we purchased a 160 slice CT machine. The highest presently in Nigeria, you can go and verify. And this 162, the risk of exposing patients to radiation is not there. Other CT machines can take up to 5 minutes, 6 minutes scanning a patient, but this 160 slice CT machine can scan a patient in 0.03 seconds. And also it does other functional MRI studies too. We can use it for cardiac CT investigations, calcium scoring, CT myelogram, and all the angio studies. So in Labrad, we don't just buy machine, we make sure we get the best machine that will give doctors and our patients all the best results they can ever get. Yeah.
Okay, again, please, the office address and phone numbers, quickly.
Okay, we have our main office opposite Federal Secretariat behind the Linksford Station, Port Harcourt Road. We also have our MRI office at kilometer 17 over the Port Harcourt Road, Mburichi, besides Regions Hospital. We have another branch too at Kachimo Plaza, opposite Liquid Bulk Fuel Station at Obinze.
Okay, thank you so much. I'll read out the numbers toward the end of the or let me just do it now because you have 1 minute of your sponsorship time. 0707 070 44 44 4465. Again, 070 44 44 4465, or you call 070 33501252, 070 33501252, or you locate them opposite Federal Secretariat behind Ebere Links filling station. They have about 3 centers right in Owerri. So when you call those numbers, they will direct you. Thank you so much, Nurse Iwoma Emmanuel and Chimezie Chinenye. And I'll go back quickly to Dr. Ehirim as we try to summarize. We have barely 2 minutes left. So, Dr. Ehirim, what are the options for carriers? I mean, couples who intend to get married or couples who are already married and then along the line now discover that they are ASAS. What options do they have?
Now, for those who have not married and are pondering what to do, my advice is please do not go down this path. Do not go down this path. You know, love is a beautiful thing.
Yeah.
But we have discovered that when the pain begins to rain down, the love turns to pain.
Kai.
The second advice, of course, is to those who are already married and they are wondering what to do. Some people are saying, you know, some people, like they tell me in some studios, oh, please tell them to divorce. That's not for me to do. The Nigerian Constitution allows for freedom of association.
Very true.
So if you are married, the decision whether to stay in the marriage or to have children, it remains yours and yours alone.
Okay.
So I would advise you that you sit down together and work out what to do. Do you want to have children? There are diagnostics that can detect whether this baby, the fetus, whether the embryo, it has this condition. But then again, the question is, if you now find out that your child has SS, hemoglobin gene, what do you do?
That's
do you
true.
now go ahead and terminate the pregnancy? I do not advise that because that will make me an accomplice.
Okay.
So what our advice is, sit down together as a couple, those of you who are already married, and work out what you want to do.
So there are other interventions like IVF, not IVF, sorry, adoption and other things, you know, that they can also go for, right?
Exactly. But then again, it's also good to point out here, even though we're not encouraging people that carry the trait to get married,
Okay.
that for every pregnancy, for people that carry the sickle cell trait, in other words, AS and AS, it's a 25% chance that they're going to produce people that have SS. That means also there's a possibility, a 75% chance that they're going to produce AS or AA.
Okay.
There are couples that have gone ahead to produce only AA, even though they're AS, both of them.
Yeah.
There are those that have gone ahead to produce AS throughout.
Okay.
However, 25% chance also means that you could have 7 children and all of them are SS.
Oh my.
So then it comes with its own risks. So it's something that the couple will need to sit down together with their relations, advisors, and all the people involved and decide
on
what to do.
Thank you so much. Any parting word before we go?
Now, the parting word is simple, which I've always said, that this is a point mutation. It was detected close to 100 years ago. Why are we still having children born that have this disease? So the government should go all out. Churches, organizations should go all out and make sure that this does not continue to happen. There are many people in the villages who have no access to diagnostic facilities. Please come to Owerri, come to places like Labrad, come to, there are diagnostic facilities available.
Okay.
Please do not go on to that marriage without being sure of your hemoglobin genetic status.
Okay, thank you so much. I'd like to thank you, Dr. Chinedum Ehirim, consultant hematologist, Nurse Iwoma Emmanuel Chukwuemeka, and Chimezie Chinenye. Thank you all for coming this morning.
Thank you very much.
And I wish you the best going forward. You heard what Dr. Ehirim said. Barry also talked about prophecies this morning. So why not use your platform? I mean, religious leaders listening to me at this time. Yes, I'm going to say it. Use your platform to sensitize people on the right thing. Don't encourage your what do they call it, congregation to get married, even when you know that they are SSSS or ASAS. You'll be putting their lives at risk. You'll be putting the lives of their unborn children at risk. So why not go ahead to discourage such things? I don't want to talk much, but maybe some other day I will revisit this aspect and link it to medicine. Thank you for joining us this morning at 12. It's already 12. Oh, mine. In a few seconds, we'll bring you the news at noon. My name is Mary Omeniwo. They call me the Slim Diva, your most adorable, and I am out.
It's the sound of the city. Echo 100.7.
Lovely afternoon to you. It's the 25th day of June 2026. Good afternoon and welcome to the Global News at Noon right here on Echo FM 100.7 Owerri, the station with fair and balanced reporting. My name is Mary Omeniwo, bringing you the latest news and breaking stories around the world. Here are the headlines. Tinubu urges Africa to turn resource wealth into industrial powerhouse. Abia inaugurates anti-corruption steering committee. Petrol remains pricey as crude crashes to $73. And on the foreign scene this afternoon, twin earthquakes kill 32, injure over 700 in Venezuela. And state police will protect persecuted Nigerian Christians. This is according to a U.S. lawmaker. And on sports news, South Africa stuns South Korea to make World Cup history. Details shortly. And as usual, we begin with national stories that says President Bola Ahmed Tinubu has urged African countries to end the long-standing practice of exporting raw materials while importing finished products, insisting that the continent must embrace local processing, value addition, and industrialization to transform its vast natural resources into sustainable economic prosperity. Speaking at the opening of the 2026 African Natural Resources and Energy Investment Summit in Abuja, the president, represented by the Minister of Solid Minerals Development, Dr. Dele Alake, stated that Africa's future prosperity depends on its ability to process its minerals locally, build industrial capacity, and create value across the supply chain. The president argued that Africa must move beyond fragmented approaches to development and embrace a unified vision that prioritizes manufacturing and industrial growth. According to him, the continent's strategic reserves of critical minerals place Africa at the heart of the global energy transition, but sustainable economic gains would only come when African countries move up the value chain. And back to the southeast, the Abia state government has inaugurated the state strategy for integrity, accountability, and anti-corruption steering committee, charging members to commence implementation of the state's anti-corruption framework immediately. Inaugurating the committee in Umuahia, the state head of service, Mr. Benson Ojeikire, stated that the establishment of the committee demonstrates the government's commitment to institutionalizing integrity and accountability across the public service. Ojeikire noted that members were carefully selected due to their strategic positions and capacity to drive the implementation of the state's anti-corruption agenda. According to him, the committee, which is made up largely of permanent secretaries and senior government officials, is expected to provide policy direction, monitor implementation progress, address emerging challenges, and ensure that the objectives of the state strategy for integrity, accountability, and anti-corruption are achieved. In another development, the Oyo State Executive Council has appealed to the Nigerian Union of Teachers to allow students go back to school and discontinue the disruption of academic calendar. The appeal was contained in a statement issued by the Commissioner for Information, Dotun Oyelade, after the council's meeting. The NUT has directed teachers in public schools in the state to shun classrooms following the May 15, 2026 abduction of teachers and pupils in Orire local government area of the state. The NUT hinged the reopening of schools in the state on the government putting adequate security measures in place. Meanwhile, the Secretary of the Union, Mr. Olukayode Salami, stated that the union's decision to withdraw teachers from classrooms was prompted by growing insecurity, including the killing of 2 teachers and the continued captivity of abducted victims. He therefore noted that schools might reopen the moment the government implements adequate security measures to restore confidence among teachers, parents, and learners. And over to Lagos, where the Economic and Financial Crimes Commission, EFCC, is already investigating a Lagos-based Bureau de Change operator, Mokhtar Adamu Mohammed, and 3 companies linked to him for alleged terrorism financing before the United States government imposed sanctions on them. Sources within the anti-graft agency have disclosed. The development comes after the United States designated Mohammed and 3 Nigerian companies linked to him as alleged financial facilitators of activities linked to the Islamic State of Iraq and Syria. The designation formed part of a broader action targeting 3 individuals and 6 entities accused of facilitating the movement of funds for ISIS operations across different countries. Although the EFCC is yet to issue an official statement on the matter, sources say the Commission's investigation focused on alleged terrorism financing activities and financial transactions suspected to be linked to terrorist operations. The sources, however, declined to disclose when formal charges will be filed. It's exactly 8 minutes past noon. If you just joined us, you are listening to the global news at noon right here on Echo FM 100.7 Owerri. Here's a recap of the headlines this afternoon. Tinubu urges Africa to turn resource wealth into industrial powerhouse. Abia inaugurates anti-corruption steering committee. Petrol remains pricey as crude crashes to $73. On the foreign scene, twin earthquakes kill 32, injure over 700 in Venezuela. And state police will protect persecuted Nigerian Christians, says U.S. lawmaker. And on sports news, South Africa stunned South Korea to make World Cup history. We'll bring you details after this timeout. Please stay tuned.
This is a public service announcement. In an effort to enhance road safety and minimize the risks of crash-related fatalities, Federal Road Safety Corps Imo Sector Command is urging citizens to promptly report any road crashes to the Corps Emergency Hotline. In the event of a road crash, citizens are advised to call the Corps Emergency Toll-Free Hotline at 122 to report the incident, or any of the Imo Sector Hotline 0913 960 0904. Provide as much information as possible, including the location of the crash and the number of people involved. Stay on the line to receive guidance from the Corps Response Team. The Sector Commander urges all citizens to take an active role in promoting road safety by promptly reporting any road crashes. Together, we can work towards reducing the rate of road crash fatalities and creating safer roads for everyone. This message is brought to you by Echo FM 100.7 in partnership with the Federal Road Safety Corps Imo Sector Command as part of our corporate social responsibility. Thank you for listening.
Thank you so much for staying tuned. If you just tuned in, you are listening to the Global News at Noon right here on Echo FM 100.7 Owerri. Over now to the rest of the news. And in business news, the price of petrol has remained high, even as crude oil prices crashed to $73 per barrel, the lowest level since the U.S.-Iran conflict began in February. According to reports, crude oil fell from $76.75 per barrel to $73.50, extending the deadline in oil prices since the United States and Iran signed a peace deal. However, petrol prices have yet to drop in line with the latest crude oil rates. Following the drop in crude oil prices from a high of about $120 per barrel during the U.S.-Iran conflict to around $73 after a peace deal was reached on June 14th, many Nigerians expected petrol prices to fall below 1,000 naira per litre. That expectation is yet to materialize. Over now to the sad news on the foreign scene that says a powerful twin earthquake has killed at least 32 people and injured more than 700, the nation's interim president has stated, after the massive shocks collapsed entire buildings and sent people running into panic. Authorities and average Venezuelans were seen on piles of rubble in the hunt for survivors after the disaster that prompted leader Delcy Rodriguez to declare a state of emergency. The earthquakes with magnitude 7.2 and 7.5 struck the same area of Venezuela, according to the United States Geological Survey, causing buildings in the capital to crumble and forcing the closure of the country's main airport. Interior Minister Diosdado asked people to leave their homes, adding that gas supplies had been cut to several buildings as a precaution. Meanwhile, the Makita International Airport located near Caracas was closed due to serious damage to its infrastructure, with social media posts showing its severely damaged facilities. Still on the foreign scene, a United States lawmaker, Riley Moore, has welcomed the Nigerian Senate's passage of the Constitution Alteration Bill seeking to establish state police, saying the reform would help states better protect citizens, particularly persecuted Christians. Moore, who represents West Virginia's 2nd Congressional District in the U.S. House of Representatives, made the remarks in a post on his X handle. His reaction followed the Senate's approval of the bill, which seeks to decentralize policing by allowing states to establish their own police services alongside the Nigerian police force. Moore, who has previously spoken on attacks against Christians in Nigeria, said the reform was one he had advocated both publicly and privately. The U.S. lawmaker also commended President Bola Tinubu for backing the proposal, but noted that the amendment must still secure the approval of at least 3 2/3 of the state houses of assembly before it can take effect. The Senate passed the Constitution Alteration Bill seeking to establish state police across the Federation after more than 2/3 of senators voted in support during a manual voting process. And lastly, on sports news, South Africa beat South Korea 1-0 to reach the World Cup knockout rounds for the first time in their history. An astonishing turnaround after a dismal opening defeat. The Bafana will be playing in a World Cup for the first time since they hosted it in 2010. They were widely written off after their 2-0 loss to Group A winners Mexico in the tournament's cutting racer. However, they battled to a draw against Czech Republic and came out on top of what was effectively a shootout with South Korea for second place in Monterrey. South Korea pushed hard in the closing stages but ran out of time, meaning South Africa will face co-host Canada in Los Angeles on June 28th. Co-host Mexico topped the group with 9 points after winning all 3 of their matches. And that brings an end to the global news at noon this afternoon, as was put together by our news team. For more information and inquiries, please visit us on social media on Facebook at Echo FM 100.7 Owerri and Echo FM 100.7, on X at Echo FM _Owerri, Instagram at Echo FM 100.7, and YouTube at Echo FM 100.7. You can listen to us anywhere in the world by visiting www.echofm.net. That is www.echofm.net, or you can search for us on Radio Garden. My name is Mary Omeni Wode. Thank you for listening. Good afternoon to you.
It's the sound of the city. Echo